Time's showing 4 o'clock, so we'd like to get started. Let me remind you that we are still under a mask mandate in all of the buildings in Watauga County, so if you failed to pull it up as you came in the door, please remember to do that. And I thank you for that. Don't see anyone, is just a general reminder. We have a special call meeting today to consider our COVID policy. This was precipitated by a governor's announcement following our last meeting. On Monday of last week, we made an announcement about recommendations from the North Carolina DHHS. So we felt like we ought to get together and review our policy. This meeting is a special call. We accept public comment. I think in every one of our regular scheduled meetings, we're not asking for public comment during this meeting, and we have received so much information from so many people. We're grateful for people's interest and how they've been reaching out. We've had a good deal of public comment the last couple of sessions. We received large amounts of email with information supporting all sides of the school mask issue. So we feel like we're pretty well informed. Now it's time, and we failed to get this on here, but we always start a meeting with a moment of silence. So if you all would give us a moment, we'd like to just take a moment of silence before we begin our discussions. Thank you. Again, thank you very much. We'll welcome everyone. And our first item is discussion and adjustment of agenda. And it's a one-item agenda, so I don't guess we have any discussion or adjustment on that. So are we good to continue, board members? All right. Now it's time, Dr. Elliott's going to give us an update from last week and maybe even a little additional information if you choose to do so, sir, about the COVID situation.
Yeah, absolutely. And I just want to say, again, last time we had the meeting here, and with a full room that sometimes people have difficulty hearing, each of the 3 microphones are on and connected to the amplifier. So if you choose to speak, if you might want to bring the microphone closer to you. Dr. Blanton's going to be my barometer of sound. Can you hear me okay? All right. All right, thank you. I'm going to give you the typical, first of all, it's good to see everyone here. Thank you all for your attention to this and for being engaged and supported. Especially appreciate seeing some students that were here earlier. Got to talk to them for a little bit. So thank you. Thank you to the parents who are here. Teachers, we have some principals here always, and they pointed out that I forgot to mention them last time, but thank you to our school resource officers for being here and all that you do as well. Even Paul. So thank you. Thank you very much. All right, I'm going to give you what you have typically asked for in terms of your normal COVID update. You have a packet at your table. I'm just going to hit some highlights. Literally, I've highlighted a few things for you. I want to just go back, even looking back over a couple of years to the long journey that we have been through leading up to today and continuing into the future as well. But I just want to say thank you to the Board of Education on behalf of the community, but our teachers, our schools, our parents, kids, even those who've emailed this week to express agreement or disagreement about the direction of the board as it relates to mask mandates, have all thanked the board for what you have done in the community. I don't want you to forget about that. The very first community-wide COVID testing event occurred at Watauga High School. The very first community-wide vaccine clinic occurred at Watauga High School. Outside of healthcare, the employees of Watauga County Schools were among the first in the community to have access to vaccines. And we've held vaccine clinics at our schools for those parents who wanted their children to be vaccinated. To say nothing of providing laptop computers that are paid for by the county commissioners, the 250,000 meals that were served when schools were in remote instruction last year, the additional nurses that you've hired, the sanitation and cleaning equipment, masks, additional teachers' assistants, all that you have done to help to manage this situation as best it could be. And I continue to say that we've managed this as well as anyone has, so far as you look at the fact that we've not had a single student cluster or outbreak among students in our schools. We've not had to close a classroom, not had to close a school. We've been able, under very difficult circumstances, to continue education for our children to the extent possible, including our virtual academy for those families who did not want to come to school in person, either because of masks or because of the virus or whatever that was. So thank you for that. Also want to thank our community partners who continue to work with us. That includes Boone Drug, App Healthcare, our local pediatricians, Samaritan's Purse, and others who continue to collaborate with us. And I'll be sharing with you in just a moment some additional resources that we're going to provide to families in collaboration with those partners. Updated metrics, probably you follow the metrics as closely as I do, but as I shared with you last week, metrics are continuing to improve and improve very quickly. And I shared with you last week the pros and cons of using any particular metric, whether it's community transmission cases, hospitalizations, positive test rate, to keep all of those in its proper context as we're looking at the health and safety of children in schools and keeping schools open. But they all are trending in the positive direction. What I've shared with you here is total number of student positives and secondary transmissions in school this year. I pointed out that the ratio is almost 12 to 1 or 11.4 to 1 of number of student cases to secondary transmissions. You might remember me telling you in the past that the ABC Collaborative says that you're in a good place if you can keep that ratio anywhere above 10. That means that you are limiting the spread of COVID in schools. And that's a positive thing, and that you might consider peeling back some of the layers of mitigation once you've reached that point. So it's been a little more difficult during the surge of COVID, but again, those numbers are quickly declining. Looking at the CDC 7-day case count, you can see we've had a 45% decrease in cases over the last 7 days. That too is positive. I just want to point out that we get compared a lot to other counties. I think for both other counties and us, that's an unfair comparison just because of the nature and makeup of our community, largely because of the positive health attributes of so many in our community. We're often compared to others and shown to be relatively healthy as a community compared to many others. As of today, with number one being the highest, meaning the worst, test positive rate, and we talked, Mr. Ashcraft, about the fallacies of the test positive rate, but with number one being the worst, Watauga County is currently the 70th out of 100 counties. And unfortunately for some of our friends, Allegheny, Avery, and Ashe are second, third, and fifth in the state respectively. So just to say that that's not just the schools, that's the whole community pitching in, families being protective of their children, people doing what they need and should do to protect themselves, I think. I want to share with you some observations and feedback from local public health officials and local medical professionals, including doctors with whom we continue to consult and have throughout this, and we will continue to. So I'm going to summarize with their permission without naming anyone and not quoting them necessarily, but I think that you'll get the gist of the feedback that we're receiving from people. The Omicron cases are definitely declining and declining significantly. And that's the reason why we shouldn't necessarily look solely at individual case counts or community transmission numbers, because we know that variant has been so much more contagious. So our numbers are so much higher. However, as you've heard and other people have related, the impact on children and vaccinated and healthy adults appears to be very, very mild. Very, very low, very, very mild. So those are positive. The Omicron-driven cases appear here to have peaked in our local community around the 3rd week of January. And we've also seen a peak in hospitalizations, serious illness, and those serious indicators. Now, there has been some question about hospital capacity, so I've been in touch with the hospital yesterday and today. And while the hospital is nearing capacity, they aren't nearing capacity exclusively because of COVID cases. About 23% of the census or number of beds taken at the hospital right now are COVID related. But what the hospital pointed out to me, though, is that there are signs that the cases, even among those, are less severe. The number of prescriptions written for certain medications for severe cases is on the decline, and they expect to see a decline in their census soon. You might have noticed also that all the numbers that you've seen, transmissions, hospitalizations, deaths among the mountain counties, seem to be slower in declining, even though they are. It may speak to the seasonality, the cold weather, or whatever. But no concerns that have been expressed to me about hospital capacity or severity of cases. The observation was made by a doctor at the hospital that, kind of put it bluntly, that a lot of the metrics, most of the metrics are being driven by adults, unvaccinated adults, or adults with compromised immune systems or older adults with serious health conditions. That actually, if we're thinking about concern of the spread of COVID among adolescents and children, the concern is greater about the spread of COVID perhaps from healthy children to vulnerable adults within families than it is between healthy children in school or out of school, if you follow that. Okay. Also, all of them continue to point to the effectiveness of masks in slowing the spread of the vaccine, though less so, as you know, during Omicron, that the effectiveness of the masks that had previously been worn in other variants are not nearly as effective during this Omicron outbreak, though there is effectiveness of good fitting masks for those who might choose or might need to wear good fitting masks. So, just sort of generalize the feedback that I've gotten, and I'm going to read it the way that I wrote it out here. The risk-benefit of wearing a mask might support masking for individuals with significant health concerns or those who cannot be vaccinated, but likely does not support universal masking requirements at this time given the rapidly declining case rates, less severe impact on children and vaccinated adults, the availability of treatments for those who are sick with the virus, and widely available information about the virus to enable individuals to assess their own risk. That's a summation of the advice that I've gotten from our local public health and medical professionals. There is a change to the DHHS toolkit that took effect yesterday, so we spoke to that last week. Nothing has changed about that, except that on later in the week it was announced by DHHS that on March 7th there would be yet another change to the toolkit, emphasizing the importance of wearing masks in certain settings, hospitals, nursing homes, and others, and recommending masking among those who are seriously immune compromised or ill. Not a substantial change to the toolkit, but it came alongside DHHS Secretary Kinsley and Governor Cooper's recommendation that school boards begin to evaluate loosening the mask mandates. Let's see, some things haven't changed about mask requirements. For example, even in school environments where masks are not required universally, masks are still required of any adult or child during the period of isolation, so 10 days after testing positive or becoming symptomatic. So for example, hypothetically in a mask optional environment, if a child is out of school in isolation for 5 days and comes back for 5 days, the quarantine orders or the isolation orders would require that child or that adult, that employee, to still wear a mask for the remainder of those 5 days. That's not at the discretion of the board. That is still a matter of state quarantine rules. Though I'm told today that state DHHS is considering and will soon announce what and when, I do not know, further changes and flexibility to mask mandates. I suspect that that will follow what we have heard in terms of the intentions of the federal CDC to also relax some of the guidance around masks. But I just want to point out that there are two circumstances under which we don't have the discretion to make masks flexible or optional, and that is during the isolation period, even if a student or staff member returns to school, and on public transportation, so that includes white buses and yellow school buses. I do anticipate, if I'm reading the signs correctly, that in the near future that those kinds of regulations will also be relaxed in some way, but that so far is not at our prerogative. There are things that even in a mask optional environment we can and will continue to do, encouraging social distancing to the extent possible to minimize that definition of close contact, even though we and our nurses are no longer doing large-scale contact tracing. We will continue to do notifications, and I have a notification letter for you that's in your packet. That is a concern that you have heard from parents, is that if we're no longer doing contact tracing, how might they know if their child has experienced a COVID exposure at school? And we will send out that mass notification letter to a class or to an athletic team or something like that, so that the parents can be aware. We'll continue to do all of the cleaning and sanitizing as we have done after non-COVID cases. Mr. Trexler continues to supply our custodians with materials to work in their disinfecting machines, that we've continued to use those well over the last year. And we'll continue to provide, to the extent that we can, good, clean, fresh air ventilation. It's going to be warmer soon, I hope. And we'll be able to open windows, go outside, take advantage of our outdoor classrooms that we have constructed over the last couple of years, because I believe that fresh air intake and air circulation is one of the most effective things that we can do to help to minimize the spread of COVID. So my general observations, is that we currently have no restrictions that I know of regarding student activities. You have approved overnight field trips, out-of-state field trips, athletic events, guests, visitors, volunteers in schools, ASU interns and others. School is operating as normally at this time, which we are grateful for. We do have a plan for additional vaccine clinics to be hosted at our schools with App Healthcare and I believe Boone Drug.
I think it's
Just App Healthcare this time, okay? At each of our locations, I've provided you the schedule of that. Of course, it is only if that is something that a parent wants. There is no vaccine requirement or mandate in place. And I don't recommend that we make any decisions that are determined based on vaccine status. But even without publicizing it, just the nurses knowing it, sharing it with parents as they call, we had over 41 families sign up for those clinics in the first day. The first one will begin this Thursday and go over the next week and a half. And I'll be sharing that information out with parents soon. We do, at your request, have a large supply of good fitting masks for any adult staff members or students who might want them. I was asked that by a parent this morning, if we have high quality masks available for children with compromised immune systems or other needs, and we do. You inquired about the purchasing of better quality masks, other than cloth masks for children whose parents might want them, and we've ordered a small quantity of those for any families who might want those, to have those on hand. Don't believe that the shortage of quality masks for anyone who might want it is a concern at all, okay? And as I mentioned earlier, I believe that DHHS is actually going to be looking at new mask guidance in coordination with the CDC guidance. And DHHS is also looking at, as they have over time, new data metrics for ways of measuring indicators of community health, moving away from individual case rates, community transmission, and looking at more of the severity of impact, deaths, hospitalizations, vaccine rates, and things like that. And you know, we have struggled, the state, to identify quality metrics, to follow metrics. We've done the best that we can with the metrics that we have, knowing that the science and the research and public health opinions about those things evolve all throughout, which is why I've tried to give you a wide swath of information to use in your decision making. I will just generalize about that and our school data to say we're seeing great improvements as we expected that we would. Your next couple of sheets are an update in the school level data that you have. We are now at, for the second week in a row, below 3%, now close at 2% of an exclusion rate. Last week will be the last week that you see an exclusion rate that includes quarantines, because we are not quarantining anymore, which is a positive thing. But I'll just share with you that the nurses updated me this afternoon that so far we have conducted 64 investigations. That's someone coming to the nurse and saying, I don't feel well, can I get a test? Or a parent who's called the nurse to share that information, which is actually most frequently how that occurs. We've had 10 students positive and 1 secondary transmission. So if you look at, there were Mondays when we were having 60, 70 cases a day. Similarly with staff, 12 investigations, 3 positives and 1 secondary transmission. If you look at the data that was provided to you in the in the App Healthcare situation report at the end of last week, you can see the numbers are declining. And also the numbers of cases among school-aged children proportionately are also declining, which is a very positive sign. I included for you the template that the nurses developed for mass notifications around possible close contacts. And I've included for you a 1-pager update of what we expect from the March 7th DHHS changes to the toolkit. I'll be glad to answer any questions for you, but I think you have a lot of information at your disposal.
Yeah, thank you, Dr. Elliott. We continue to appreciate how much you stay on top of all this and how well you keep us informed on your weekly updates to us, as well as the information during these meetings when we have to come to some difficult decisions. Anyone have any questions for Dr. Elliott before we entertain a motion?
Well, just one quick update. The CDC had finally published updated numbers for today, since you sat down probably. and of course they've gone down significantly as well.
Right.
So 236 current cases per case rate of 420, down from 516, so.
We did,
Significant decreases.
yeah, from 290 yesterday.
Right.
Great. Obviously, we came together to discuss our current COVID policy. I kind of informally polled the board before we started the meeting to see if there wanted to be some comment, or just go ahead and see if anybody has a motion, and kind of a neutral response about the comments. So, Dr. Elliott, you have something?
Yeah, I just want to point out that if you are considering a change to the policy, I've included at your board table a copy of the board's mask policy as it exists now. And I took the liberty to draft some comments for a mask optional approach if that's what you choose to do.
Okay.
We just simply need to fill in some details there.
Gotcha.
Thank you.
Thank you. We have all commented publicly over several meetings now, the things that we consider as we have to make these very difficult decisions. And so we can go ahead and entertain a motion. I do want to make a statement though, just a momentary pause from our agenda here. During our last meeting, Monday of last week, as we were trying to have our discussion, if one or more people in the audience had an opinion that differed, or they questioned something that some of us were saying, people would speak up in the audience, and it was very distracting, and it's not supposed to happen during these meetings. Now, I am known as a soft touch, even as a school principal. I was not a hard-nosed guy about trying to get people to do what they knew they're supposed to do, and I haven't changed about that. So please just let me remind you that we need to be able to carry on our conversation without interruption here, and I ask that you just respect that. So thank you for letting me pause just a minute and get off the agenda, just to make that reminder and make that request to all of you again. So having said that, do we have anyone ready to make a motion for the board to consider?
Mr. Chairman, board members, just as I was saying last week, we've had so much information. All of you guys have texted us, wrote us, called us. And just like we did last week, I'm ready to put my motion back on the floor that we end the mask mandate as of February the 28th. I think with all the information that we've been provided over the last few days, I think that we're ready to make that, I hope that we're ready to make that choice.
Do we have a second to Mr. Combs' motion?
Second.
Ms. Cornett has seconded. Now, do we have any discussion before we call for a vote?
Mr. Combs, does your motion include the language that I included in the
Yes, sir.
policy? Thank you.
No, there were a couple things that I hoped would happen, and I think we've seen them happen.
Mr.
One,
Abrams, I can already tell you probably have to get the
Okay.
microphone close to you there.
a few
Like
weeks,
I do when I can't hear you.
okay. A few weeks ago, we had the big change in quarantine requirements, which was one major obstacle to trying to make this kind of change. The other thing was the high level of infections from Omicron. We've seen that rate come down by roughly 2/3 among students in just the last few weeks. We've seen it come down by about 80% among staff. So I think those are signs that we're getting to where we need to be. And I think this extra week gives me a much greater level of assurance relative to last week. Gives me a much greater level of assurance that this can be done appropriately and with a reasonable measure of safety, and the steps that Dr. Elliott has pointed out about having better quality masks available to anyone who wants them also gives us assurance that those who want to mask can still have a good level of protection with just themselves wearing the mask without having it required of everyone. So to me, a lot of factors are coming together where we're nearing the point at which this can be an appropriate action.
Okay. Other comment?
Of course.
Okay.
Yes,
Yeah, probably a good idea, Dr. Bennett.
Looks like it's gonna go down. So there's this Beatles song, 8 days a week, and this past week has felt like that. I personally would prefer that we go mask optional on March 7th, based on the recommendations of the HHS and the governor, to give our families just a little bit more time to figure out how they're gonna make that work. It can take time to figure that out. They'll have to talk with their children about possible scenarios that they may encounter. They may need to schedule to talk to their doctor, to talk about vaccine boosters. And so that takes time, and so I would prefer that we follow the recommendations and give them that time. However, and I was prepared to put on my pedantic professor hat, and try to convince everyone here of why March 7th is the best date. A date of March 7th would also be problematic. The legislature has passed Senate Bill 173 that has a February 28th date in it. The governor has not acted on that yet. So, there's a number of scenarios. He could veto it, in which case the legislature most likely would override it. They have enough votes at this point to override it. He could not do anything, which means it would become law automatically Sunday evening sometime. Or he could sign it. He hasn't done that yet. So if we were to act today for March 7th, because remember, I was gonna convince everyone here, there's still this February 28th date that could override that decision that would be looming out there, and no one would quite know what's gonna happen. If an override vote were to happen, that might not happen until the 28th or the 1st. We're not quite sure of the timing for that. I'm sure it would happen quickly. So you can see there's already sort of a roller coaster that could happen. And I just don't like the unnecessary anxiety of that either, weighing on our families. So I will support the motion.
Thank you.
If I may, Dr. Childers, just point out about that legislation, it has two very important components. One is that if passed, parents could opt out of any mask mandate that is in place. And the other is that it would rescind the requirement that boards of education vote monthly on a local mask mandate. And I concur with Dr. Fenwick's sense that it is likely to pass into law in some form or fashion. And as much advance notice for our families as possible, I think would be beneficial.
Other comment? I'll share my thoughts. I too struggled with when. I know it's time, but it was a matter of when is the best time. And I too wanted to give, one of the thoughts I had was I wanted to give our families who have still extreme concern and fear about the virus to make as much preparation as time as possible. And that was my position a week ago. I still feel that, but also on the same hand, there's been so much happened by way of sending messages to all of us, to public in general, that mask mandates are going to go away. And I think people who are really in tune with what's going on in our state, in our country, they should know and have been preparing for this eventuality. So I'm a little more at peace in terms of thinking about it that way, and also can support the motion to move to the 28th. I like waiting to the 28th because it gives our folks some time to shift in our schools, to make that shift. It does give folks a little extra time, our parents who may feel like they need to make a few more preparations with their children by way of finding really good masks if they want their children to continue wearing them, and also talking with them. I can't remember who I referenced to, but obviously I don't have children in school anymore, but I have grandchildren in public school. And I was talking to our son about what was his approach going to be, because my two grandchildren there are going to be come Monday under a not mask optional too. So it's weighing heavy on all of us, but I think it's time and can support this motion as well. So before I call for a vote, any other comment by board members? Dr. Elliott, a matter of protocol, should we read what we're going, the full intent of this motion before we vote on it?
I'll be glad to.
Folks here and media can pick up on it. I think maybe we're supposed to do that anyway.
I'll be glad to. Draft for consideration on August 30th, 2021, Governor Cooper signed Session Law 2021-130, which was Senate Bill 654. The law called an act to provide relief to public schools in response to the coronavirus disease 2019 pandemic, and include the following provision. Effective immediately, all school boards must, 1, adopt a policy regarding the use of face coverings by employees and students, and 2, vote at least once a month on whether the face covering policy should be modified. Pursuant to this requirement, the policy of the Watauga County Board of Education is to direct the superintendent of schools to implement and enforce the decision of the board as adopted by whatever vote that you make on February the
If we
20th.
do approve, which will,
If you do approve.
we will insert February 28th in that area.
Will it be adopted today?
So we adopted it.
Yeah, be adopted today. And here's the change of the language. The policy of the board is as follows. The Board of Education strongly recommends that all parents, students, and employees take precautions to prevent the spread of COVID-19 in our schools and community. Effective February the 28th, for the motion, the policy of the board will be to make the wearing of masks optional for everyone while inside or outside of school-owned facilities and vehicles, except as required by local, state, or federal regulations. That is to include the quarantine rule and the CDC transportation requirement. Masks will remain required on all white and yellow school buses unless or until such a mandate is lifted by the federal government. This shall be the policy of the Watauga County Board of Education until amended or rescinded by a vote of the board during an open session.
Thank you, Dr. Elliott, for reading that. All in favor of Mr. Combs' motion, please raise your hand. That is unanimous. Thank you very much. Any other board comment before we adjourn today?
I would just like to say, I appreciate the concerns of our community. I love to see all you guys turn out. It lets us know that you really, really care about your kids, just as much as we care about your kids. And I think that if we move forward, everybody's gonna be fine. I think it's time that we do this. We can't go on forever wearing masks. And all the indications and all the things that's been sent to us have indicated that it's time for us to take away the masks, so I'm ready for this to happen.
Thank you.
Agreed here.
Thank you. I was gonna thank everybody for holding back there. And, just, sorry. Any other board comments?
Yeah, I have a couple thank yous as well. To everyone here today for being very respectful and for being present. I want to thank everyone for the emails that we've gotten this past week. It's been a busy week from both sides, but also very respectful, so I appreciate that. Thank you to Dr. Elliott for his usual thorough information, but even more this week. I think we got some new perspectives from some local numbers, so I appreciate that. I wanted to thank the board chair who has reached out this week to each of us to make sure that we're okay while we're thinking through this issue. And it has definitely been, a couple of difficult nights sleeping trying to get this out of your mind while you're thinking about all the ramifications. So I appreciate him. And I would like to thank all the children and families and teachers for doing it so well for so long. It certainly has been a challenge, and it's not completely over. But I appreciate all the work that they've put in.
Thank you. Comments? I will just echo my gratitude to all of our community members who have reached out. We have received a lot of communications. Obviously, as everyone would know, some critical, some complimentary, some in the middle. A lot of folks being very supportive, but a lot of folks continuing to, feel strongly and passionately about how they feel. And we understand that and respect that as well. So again, thank you all for being a good audience for us this evening and letting us get our conversation held without interruption and coming to a decision. If there are no further board comments, I will ask for a motion to adjourn.
So move.
Motion second?
Second.
Second. Any discussion? All in favor?
I'm sorry, I just might ask, we stole this room
Oh, yeah.
away from Yolanda Adams, who's about to have a community meeting here at 5 o'clock. So folks are welcome to stay and visit for a little bit, but by 5 o'clock, we're gonna turn it over to Yolanda, so thank you. Sorry to interrupt your vote.
So, very good, you got me right before we.
Sorry.
All in favor of adjournment, raise your hand.
Thank you.
Yeah, we do have to have this room clear by 5 for other